non-communicable diseases, that is the meaning of NCDs, are diseases that are chronic in nature, that is, they are lifelong. And it is important to know that the diseases are associated with high mortality and high morbidity. So high morbidity and high mortality is one of the issue of non-communicable diseases.
And in fact, the country is tilting towards a double burden country. A double burden country in the sense that the non-communicable diseases are even overtaking the burden of communicable diseases.
Non-communicable diseases, NCDs, are on the rise in Nigeria, as elsewhere worldwide. Among these, a silent but familiar killer looms: hypertension. Affecting millions, it strikes without warning, leaving behind a trail of devastation. Once seen as a problem for specialists alone, the burden of hypertension in Nigeria has grown too large to ignore. But amidst this growing challenge, a new approach is lighting the path to a healthier Nigeria.
We shifted the task to the basic healthcare level.
And once it is not complicated, it will be managed.
A patient at the barest, at the remotest, the lowest level of health care facility can get a hypertension screening.
If there is any complication, the protocol has also been designed in such a way that they can refer to the next level, that's the secondary health facility.
Recognizing the need for change, Nigeria has embarked on a revolutionary journey. Efforts such as the National Hypertension Control Initiative are transforming the way hypertension is managed by broadening care for simple, uncomplicated hypertension from specialist centers to the very heart of our communities through the primary health care (PHC) centers. This decentralized approach, guided by the minister's mandate to improve population health and align with World Health Organization HEART's model, is breaking barriers and expanding access to care for millions of Nigerians.
As you know that hypertension is like a silent killer. Many people are not aware that they have hypertension, but they will be moving around with it until they develop complications like stroke or heart diseases. That's when they present to the hospital. Sometimes it may be too late to do something. So therefore, this NHI program helps the populace of Kano to be scared, to have their blood pressure screened so that they will not develop these complications.
Ban san ma ina da shi ba. Yawanci dai ina jin ciwon kai, in ji jiri so time. So ɗana ba lafiya sai na kai shi asibiti. Da na kai shi an gama mai sai na tunanin to ni ma in tsaya mana a duba ni, sai aka duba ni aka ce ai ina da hawan jini. Na ce to abin ya ban mamaki, sai aka ce ai yanayi ne. Kowa yana samun kanshi a haka. To alhamdulillah ala kulli halin akan da kan ina yawan ciwon kai, zazzabi, jiri. To da na dora akan magani aka bude man fayil. To alhamdulillah gaskiya bana jin wata matsala yanzu.
Well, the Hypertension Control Initiative program started sometimes around 2021 in Ogun State. We started initially with 12 facilities in few selected local government, but as of today, we are currently in 52 facilities across the 20 local government.
Mo dúpẹ́ fún àwọn ìjọba wa kó má dáwọ́ irú nǹkan báyìí dúró lórí ọ̀pọ̀lọpọ̀ èèyàn náà tó yóò bá jẹ́ pé ohun tó gbé jáde yìí ọ̀pọ̀lọpọ̀ èèyàn á ti kú. A dúpẹ́ lọ́wọ́ Ọlọ́run pé gbogbo ìtọ́jú tó ń fún wa òun ni ò jẹ́ kí nǹkan kan ṣe wá mọ́. À ń rí oorun sùn bóyá yẹ ká sùn gbogbo ẹ̀ ń lọ déédéé.
We educate the people that you have to come for screening, even you don't feel any symptoms in your body.
So, for those people that were afflicted, when they get back to their community, they inform their friends that this is what is happening at a health facility. You don't need to go to Federal Medical Center. They have BP medication at affordable prices.
But the journey is not without its challenges. Ensuring consistent pricing for medication and retaining patients in care are ongoing battles.
We are able to achieve some significant number of progress, but despite that, we're still having challenge. And one of the major challenge is, the financial hardship, we are having in country. People are battling with food, and now you have to take care of pills every day for the rest of your life, in addition to hospital visits. So one of the key challenges is the supply chain, of that essential drugs, especially the losartan, and amlodipine. For people even to get, when we started, we had the seed money, which, like the drugs were given to us, and we put it through our drug revolving fund. But still, we're having significant number of lost follow-up, up to maybe 30%.
Clients that are on treatment decide not to come back to care, not to come back for follow-up, not taking their drug again. And this is as a result of asymptomatic effect of hypertension. They believe they are fine, they are okay, and they decide to drop drugs. So what we have put in place is, for now, is community engagement. And then secondly, we are planning to we are already scaling up to more facilities.
We believe that scaling up will make, the management and treatment closer to the people, and we hope that this will be reversed by the scale up to the 236 health facility across the state.
Primary health care is not just the first line of defense, it is the cornerstone of a resilient health system. By treating hypertension at the PHC level, we bring care closer to those who need it most, especially underserved areas. The success of this initiative is a beacon of hope. But to truly combat the growing tide of hypertension and other NCDs, we all need to join this movement.
We are bringing NCDs to the front burner. If you look at the budget for this year, NCDs came up. The funding was higher. Now, because of decentralization, we have funding for making sure that the capacity of healthcare workers are built, especially for NCDs. 2, for the diabetes mellitus, using the glucometer to make sure we'll be able to. 3, the government has come up with a lot of policies in a multi-sectorial manner. In fact, we have the technical working group that will provide technical guidance to the government in a bringing every stakeholder to make sure private sector, the government, the manufacturers of medicines, the manufacturers of health commodities, every person on the table to make sure. Because it's no more a disease that is hidden. People are coming up, and then we're bringing in the health promotion aspect of it. Awareness creation, very important. Why are we having a lot of cancers? Why are young people coming up with high blood pressure? Why are young people born with diabetes?
We urge all stakeholders, governments, development partners, philanthropists, and the good people of Nigeria to champion this cause. Together, we can combat hypertension and other non-communicable diseases and pave the way for a healthier future for all.